My name is Monica Schrader, and I'm a physical therapist and athletic trainer here at Forte Sports Medicine. And besides seeing regular patient care, I also oversee the patient education for our total joint rehab program. When a patient sees their physician or their surgeon, they've decided to have a total joint surgery, then we contact that patient and we coordinate prehab physical therapy appointment here with myself, or we have a team of physical therapists that do that, or with one of the other team members. And what that entails is bringing the patient and their caregiver, or whoever, a friend, family member, whoever is going to be helping them out for that first week in particular after surgery, bringing them in and trying to educate them on expectations, what will happen the day after surgery, what's the expectations there in terms of healing timelines, functional timelines, when you're going to be back to work, when you can get back to your leisure activities. Those are some of the basics we cover. We also try to get them to understand healing properties of their surgery. We have this narrative of information that we want to share with the patient, but within that narrative, it's what type of house do you live in? Do you live in a 3-story townhome with 5 entry steps? Or do you live in a 1-story house that has 1 little entry step? We can talk about where their situations, where their bedroom is, where they're going to be living. If they have a home office, it's on the basement. We don't really want them to be going up and downstairs a lot during those first 2 to 3 weeks, so we may give some suggestions to bring their home office up to the main floor. There's that type of home kind of personalized, where do you live and how do you live, and what do we need to do to adapt to you, your needs, and also looking at adaptive equipment that they're going to need to get them through the next about month post-op. And so by the time we go through the exam and I explain what's going to happen the day of surgery, and then following up with home health PT or outpatient, kind of those things, and then I go through a PowerPoint presentation that is copied. We go through it on a screen, but they also have a handout so they can take that home and refer back to it. The biggest goal here of the patient education is to give them that broad-based education, but specific to their environment or their needs or their lifestyle, so that when they come home from surgery, the day they get home from surgery, they can walk in their house and everything is ready to go. And there's no more questions. They come in, they're calmer, their anxiety levels are down about 5 notches. They can come in, settle in, and focus on their job of getting better. We kind of want to optimize everything we can control to have a really good rehabilitation as they go along.